Thank you very much. The concept I would like to introduce today, I think, is a very novel one. For many years, since the inception of electronic cigarettes, we've been more concerned about harm than health benefits. And that's where my talk is going to shift. I want to focus a little bit more on the beneficial health effects of these products. Of course, this is a very challenging task. You are all very much aware of this data. This is a conferencing kind of decision-making process, which was measuring different, the level of harms in different nicotine-containing products by looking at different harm items. And it is self-evident that in 2013, when a group of experts got together in London, in a very sunny day in London, we estimated this risk continuum across different products. And today, 2 years later, I still believe that this kind of classification really stands. But the real challenge is that we really need to shift from risk reduction to something different, harm reversion. Why? Because it is, to me, and my experience in the clinic shows it, it's kind of obvious that substitution of smoking with vaping, it is likely to reduce burden of smoking-related disease. The problem is that this direct evidence will not be available for decades. And in fact, when I first started to learn about tobacco harm reduction, I had to read a lot of Lars Armstrong work on snus, trying to, in a way, find a parallel to what is the tobacco harm reduction in snus in relation to other products that can be more culturally accepted in other countries. So this direct evidence will be not available for decades. So what do we do? Are we stuck? No. We can show some improvement. And we can devise, in my opinion, two different strategies. One, let's focus on early sensitive changes in healthy smokers that can be measurable. And two, let's look at more sound outcomes of disease progression in people who vape and who also have a pre-existing disease. So let me start with the healthy smokers, and we use the ECLAT cohort to show this point. In the ECLAT cohort, there were a number of study assessments being carried out over a period of time, up to 1 year. One of these assessments was very simply to measure blood pressure at different time points. And that's what we measure by looking at the continuous smoking phenotypes. This is very important, looking at continuous smoking phenotypes. So these people were characterized as failure, reducers, and quitters who have been failures, reducers, and quitters at all different time points of observation throughout the study. So their phenotype is stable. And that's important to show differences when it comes to biological biomarkers or biological effects. It's fairly obvious from this slide that nothing happened across the three phenotypes. And this is logical, because by inclusion criteria, these patients were all normal. However, when we looked at those that at baseline had a slightly raised blood pressure, we categorize them as high normal, so it's something like pre-hypertension. There is evidence of harm reversal across these phenotypes. And this is data from a large survey from Konstantinos Varsalinos, who's watching me closely. And And, you know, our findings in the clinic are very much in line with the findings by this survey. About 50% of people with a diagnosis of hypertension in this survey had improved blood pressure. Okay, another problem when you have people quitting smoking is post-cessation weight gain. Again, in ECLAT, we had serial measurements of body mass and body weight across different time points for continuous smoking phenotypes, and that's what we got. As expected, you do have some increase in weight in those who quit by switching to electronic cigarettes. However, the interesting data is that by the end of the study, this is not significant anymore. And just look at the y-axis. It's only a 4% variation from baseline, which is something that normally occurs when you have a Thanksgiving day. You know, there a yo-yo effect in your diet. But let's compare the ECLAT data with the Cochrane. This is the Cochrane analysis showing that overall there's a quite large increase in weight at 1 year after you quit smoking. In the ECLAT study, by using this approach, this post-cessation weight gain was very much limited. And this has incredible potential from a cardiovascular risk point of view. I'm a respiratory physician by training, so I couldn't take out the spirometry. So we did spirometry test. Of course, these, again, normal people, so it wasn't unexpected to find major changes in their lung function test. However, very sensitive tests like the FEF 2575 data could pick up some improvement at the very peripheral airway level. We know from the clinics that smokers have FEF 2575 altered just because they smoke, and it is, as you can see here, reversible. We also look at the respiratory symptoms. We know that respiratory symptoms are proxy for chronic airway disease over time. And in the same study, that's what happened. Cough dissolved, basically, at 24 and 52 weeks. None of the patients were complaining about cough after a certain period of time, and the same for shortness of breath. Although at the baseline, they were much, there was high prevalence. So this is the story for people who we consider healthy from a randomized controlled trial point of view. What about those with pre-existing disease? I just focus on asthma because this is my main area of interest. And we know from the literature that smoking cessation does a lot of good to different asthma outcomes. So it was obvious for me to engage in a research investigating the role of regular vaping on asthma outcomes, okay? And of course, the first important data there is that by using electronic cigarettes, these asthma smokers were successful in reducing tobacco consumption by a big deal. You can see their baseline is about 22 cigarettes per day, going down to 5, and then to 4 on average. In our world, in the asthma world, it's very important as a very strong clinical outcome to measure exacerbation. You can see here that there's not very much difference in exacerbation, mainly because at baseline, these people were not heavy exacerbators. So they were exacerbating once or twice a year, which is basically normal. Every time you get a flu, you get exacerbation. So it's to be expected. However, there were a bunch of people in these subgroups with more than 2 exacerbations a day, and for these people, there was some improvement. To cut a long story short, we showed and published data about objective outcomes and the lung function, who is improving. We also done a prospective follow-up of the same very people up to 2 years, and it's confirming improvement in forced expiratory volume at first second. Of course, the FEF2575 is also improving quite early with the regular use of electronic cigarette, and this is also being confirmed at the 2 years time point in this small uncontrolled population. Methacholine PC20, try to think of twitchy airways of the asthmatics. Asthmatics going to the Alps, they inhale fresh, clear, dry air from the, from the mountains, and they got asthma. With the fresh air, the cleanest air possible, they got asthma because they had got twitchy airs. However, when they start regular vaping, their twitchiness level is reduced significantly, as you can see here, and it's stable up to 2 years. Quality of life, similar story. They go hand in hand with lung function, and you will see there is an improvement in asthma quality of life early and up to 2 years, stable. These products were very much well tolerated by this population. No severe adverse reaction, no acute exacerbation, no hospitalization due to the use of these products. And this again is very much in line with the survey, the large survey run by Konstantinos Farsalinos, showing that for asthma, there's an improvement in 65% of regular users. There are implications for the medical community. Regular electronic cigarette use is unlikely to warrant significant health concerns, and I can testify that personally. Health benefits are associated with regular EC use, particularly in patients with airway diseases. So healthcare professionals should encourage vaping in smokers, and particularly in those who have underlying respiratory disease. Thank you very much.